Hi, my name is Dejanay Johnson, and the theory topic that I selected is the social cognitive theory. The social cognitive theory was developed by Albert Bandura as an interpersonal theory, so based on our insides, how we're feeling, how do we perceive things, and also the way we think. So they are influenced by several different factors, which are your environmental factors, your behavior factors, and also your cognitive factors. So, your environmental is your surroundings. Where do you live? Is it in close proximity? Your behavior is your actions. How do we act? And then cognitive is the way we feel and the way we think. So, this theory implies that one or more factor affects our behavior, it affects the way we act. And it's also known to aid in changing our behavior. So this theory also talks about learning from the behavior of others. So there's a popular experiment that was done years ago called the Boo Boo Doll experiment. And in this experiment, children were shown a video of someone beating up someone else. And it was known to see if these children would mimic that same behavior when giving a doll. And they did exact that. When given that Boo Boo doll, they began to hit, they began to beat up the doll, and it showed that the behaviors can be influenced by the environment. And this goes into thinking of those children who grow up in households where family members drink, or family members use curse words, or family members hit others, and they begin to do those same things because they're learning and they think that that's how they should behave, and that's what they learn from others. And there's also reciprocal determinism, right? And it's the interaction of people. Behavior can be influenced from our environment, and can be influenced from not only environment but cognitively, right? The way we're thinking. So a perfect example is children acting out. They act out because they don't get that attention at home. They think that, you know what, if I behave this way, they won't care. They don't care at home, so they won't care at school. Or that mindset of thinking a test would be failed, right? They think that I'm going to fail this test. I'm not ready to take the test. So then they don't understand that material, and it can cause someone to not study because they feel like I don't understand it. I'm not ready to take the test. And as a result, they begin to think that way. So they begin to take the test and then they fail the test. So this is the way the reciprocal works. You have your cognitive factors, right? Your personal factors, knowledge, what we know, what we expect in our attitude, how we perceive things, and then behavior is our actions based on skills, based on practice, and how efficient do we find ourselves. And then environmental is our social norms. Who surrounds us? How do their actions influence our behavior? Do we have access to healthcare, access to things that we need that in our community? And then again, that influence on others. So that can be changed based on our own environment. So how the people behind around us, who surround us, act on a daily basis. Okay. And then not an article, a study that I reviewed is exploring the predictors of social media use for health and wellness during COVID among adults in the US. And I picked this study because it reviewed several factors that may have influenced individuals during COVID when using social media for healthcare, for appointments, for follow up. I'm a big MyChart user. I love to use it to connect with my doctors, not only for myself, but for my children, to schedule appointments, schedule follow ups, and also just review labs and chat with them, message them in case I have any questions. The purpose of this study was to review what factors of social media can have an influence for health purposes in the social cognitive theory. So they used a system called Health Information National Trends. Participants had to be 18 years or older. This was done during high peak COVID numbers. And they were given an incentive, $2, and they completed about 6,252 surveys. And the samples were from several different households and different locations, just so they can get a widespread and a variety of information. That way their data could be precise. So they had several questions to answer. The first set was how often that they do use social media. Is it daily? Is it sometimes? Is it less than a month? And then the second set was the perception of social media. Do they strongly agree? Do they disagree? Do they just agree? Right, based on the information that they were provided on social media. And this study didn't exactly say what type of social media they used, but I know that most of the health systems have the mind chart, and with labs, there's a link that it shows you the research and you can read on it that way. So these are the factors that was noted from the participants. So environmental factors, rather they felt like they were isolated or they felt that they had a purpose in life. And you'll see in the results how it influenced their behavior to social media. So some felt like they were isolated, that they were not included with others, they felt left out. And the ones also felt that they had purpose in life, right? That their life has a meaning, that their life has a purpose. They know exactly where they're going. They have a clear sense of direction. And then personal factors is how they perceived health, right? How self-efficient they were in their beliefs and in their attitudes. And then demographics, their race, education, their knowledge, how much they made yearly, their age, and also their gender. And we know your older population wouldn't use social media as much as your younger population. So, lastly, how they perceive social media in healthcare. So, social media can be used for decision making. Rather, it was discussion with healthcare providers, like I mentioned, through chat, through messaging if you had any questions. And sometimes it can be hard to tell if social media information is true or false. You have some who always go to social media, I'm going to believe anything that I see. And you have some who have that knowledge to research it. Let me see a correlation and let me read some studies on this information. And you have some who just don't believe social media at all. Also, how health related information on social media is misleading, which it can be. Pictures can be false, it can be edited to make it look like this has worked for someone, but in all actuality, it doesn't. And then people on social media have the same views about health. So it also can be based on your followers. It can be based on, do you follow people who influence you? It can be based on, what do you see on the norm, right? So in this study, age was a factor when using social media, as I mentioned earlier. So your older population did not use much of social media for health information, but those who had a higher education level questioned health related advice from social media. As I mentioned, if someone shares a diet or any type of issue, I'm going to Google it, I'm going to research it, I'm going to find some studies on it to find a little bit more information. And I also think that's on an educational level and a knowledge level. It showed that the white population relied less on social media compared to the black population. Individuals perceived that they are in good health were more likely to discuss their health with a provider compared to those who thought they were in bad health. So those patients who thought they were in good health were actually scheduling those appointments. They were scheduling follow up. They were reviewing labs. They were asking questions. And those who had that negative notation on their health rarely used it at all. I think it's perception. They perceive, I don't want to check this. I don't want to check my labs because I know for a fact that it's not what I expect it to be. I know that it's going to be bad. And I think perception and the way of thinking played a huge factor into this idea. And participants who felt their life had a purpose were less likely to rely on social media for decision making. So if you feel like your life has a purpose, you're not going to go to someone else. You're not going to reach out to someone else because you think that you have a purpose. You know that you have a purpose compared to those individuals who may feel opposite. They're going to rely on others for information. They're going to rely on social media. They're going to rely on other postings to kind of help bridge that gap for them. So this is just a discussion of like what I've read in my research. And as I mentioned, it is an interpersonal theory. So the way we're thinking, the way we feel. Our behaviors can be influenced based on our feelings and the way we think. It also can be based on our environmental surroundings, as mentioned, the boo boo doll experiment, right? Which can affect our behavior because it is influenced by others. And then it can influence, as I seen in that article regarding the COVID-19 and the use of social media, it can influence our healthcare decision making, right? Rather, it's false data, it's misleading data, or we don't use it as much because we have that cognition that we are in good health and that we feel strongly and positive about ourselves compared to those who see differently. And these are my references. Thank you.